Get ready to open your eyes and look and feel younger with Dr. Sonny O and his refreshing new eye treatments. You get rid of under eye bags, dark circles, fine wrinkles, and more for a fresher, younger look. We welcome Dr. Sonny O to tell us about the latest treatment and options for your eyes. Let's talk about eyelid surgery. There are different types of eyelid surgery, and what is the exact medical term for eyelid surgery?
The medical term is blepharoplasty, and eyelid surgery can be performed both on the upper eyelids as well as the lower eyelids.
And when you go in, this is something that you need to take a couple of days off. Is that right for this?
The recovery is generally very well tolerated. This is something that can be done in the office, typically under local anesthesia. So it's really fairly well tolerated by most patients.
With this surgery, what will it exactly correct? Because sometimes people have the upper eye surgery because of being visually impaired, or they cannot see.
Yeah.
Tell me about that.
It's a great question, because this surgery has a couple of benefits. You know, one of the obvious benefits would be the improvement in the appearance of your eyes, because it gets rid of that extra skin.
Yeah.
But at the same time, some of the times that skin actually impairs your vision, as you said. And you know, we've partnered with our local eye care providers, including some ophthalmologists and optometrists, who can determine whether you have the amount of visual field obstruction. And if you do, oftentimes this is a procedure that is covered by insurance companies.
And when you say the vision is impaired, they do, and there's no pain involved with it, whenever they do the test. It's just like going to have a regular test. But the extra skin that starts to develop, can that be from weight loss? Can it be from age? Can it be from too much exposure to the sun? All the above?
You know, I bet the primary culprit is age. As you age, things tend to descend. Certainly there are some genetic components to it. I think, you know, there are some hereditary components. If, you know, baggy eyelids or saggy eyelids runs in the family, you know, you're certainly probably more likely to develop them. But the great thing about it is this type of procedure will not only improve how things look, but it'll improve how you see things. It'll improve your vision.
Absolutely, which is really a safety matter as well. So you can possibly look better. More than likely, you will look better with not having that extra. But then also see better. But again, the insurance in a lot of ways will take care of this. This has to be taken care of through the optometrist or ophthalmologist to give
for the patient who has the appropriate amount of obstruction. Yeah, and you know, this also kind of. When you were asking about eyelid surgery, you know, one part that is oftentimes addressed when we're doing upper eyelid surgery is the lower eyelid surgery. You know, people develop bags or puffiness underneath their eyes, and there are some great things that can be done now. You know, there's a procedure without an external scar.
Is this getting into the timeless eye now?
Yes, it is. And you know, the timeless eye is my vision of how to address the eyes, both the upper lids and the lower lids. But this procedure, which addresses the lower eyelids without an external scar, is wonderful at removing the bags. And then there are some great treatments, not only to help with the, you know, crepey, wrinkly skin underneath your eyes, but even that this little hollow right here, something that I call the tear trough, and that's been a troublesome area for patients for a long time, and I've got some great filler options for that.
So this is basically no downtime, or maybe minimal downtime, or maybe an afternoon?
It's a combination of both. Some of the treatments can certainly be what we would consider no downtime procedures, and then some of the surgical procedures really has, I would say, minimal downtime associated with them.
When you start to do any sort of surgery and so forth, there is some downtime, but this is basically some really nice fillers that help out to take away the droopiness.
Yes, the timeless glow treatments underneath the eyes will help with the wrinkling, loose skin. It will also help with kind of some what I would say hollow areas underneath the eyes.
This picture, this lady here, the top one is the before, the bottom one is the after. She looks 15 years younger.
I mean, I think there's been a very nice improvement.
At least 15 years younger.
You know, but that's really telling, because, you know, a lot of times the eyes are a feature that we pay attention to a lot to. You know, when we meet somebody, we look them in the eyes. So it's nice that there are some great options to help address that area. That's an area of concern for you.
You're saying looking in the eyes, and I'm gonna say something that's a little off script. You also do things with hands and the side of the face. I've been a patient of yours. I want you to come back next month, and I want us to have the pictures of before and after you working on me. On the sides of my face where I had some aging and some spotting from the sun, and on the top of my hands, because I've had numerous people compliment going, what happened to the age and the sunspots on your hand? Appreciate you being here, sir.
Thank you.
Can we do that next month?
We'll try, absolutely.
Yes, sir. All right, more Lowcountry Live coming up in just a moment. Stay with us. Dr. Sonny O right there on Houston Northcutt Boulevard.